Hi, I'm going to give you a quick update on federal and Maryland health laws, the electronic prescribing law, and the federal and state of Maryland have passed laws regarding electronic prescribing for controlled dangerous substances. And actually, both of them have now issued extensions. So the federal government back in November of 2021 said they were going to delay the start date for compliance actions related to electronic prescribing, which was going to be required for Medicare and Medicaid, requiring e-prescribing for controlled dangerous substances to January 1 of 2023. And last week, the state of Maryland on December 21st announced that they would also be extending compliance actions until January 1, 2023. However, with regards to the state of Maryland, if you are a Maryland practitioner who prescribes controlled dangerous substances, you need to request a waiver if you're not going to comply with the law. The announcement they made clearly said that a waiver had to be requested. There's a reason for that, and I'll go through the history of the law and why that is. But you can find that waiver request there at this page here on the health department's website. I'll also put it in the notes on the YouTube page so you can get that easily as well. It is really important that you do that, and I'll explain why when I go through the exemptions in the statute. But essentially, you have until January 1, 2022. If you're watching this after January 1, I would ask that you go ahead and fill the waiver out anyway. It is not a big deal. But if you essentially must request a waiver if you're not going to be able to e-prescribe controlled dangerous substances. This law is a little bit of an interesting history in Maryland, and I'll go through that quickly now. So essentially, in 2019, it passed House Bill 112, Senate Bill 166, which required electronic prescriptions for controlled dangerous substances. And it passed with an effective date 2 years after its passage, almost actually 3 years after its passage of January 1, 2022. It was a very difficult fight back and forth prior to its passage in 2019, and it really became hard for any group to oppose it because the federal government had put the law in place. Prior to that federal law taking effect, MedChi and a few other groups had successfully killed the bill because the state legislation was simply unfair. There weren't adequate exemptions, there were penalties that were draconian in it. It was just very difficult. However, groups, including MedChi and others who opposed the legislation, got together with the state, the pharmacists, and other interested parties and worked out a very reasonable piece of legislation that mirrored the federal law with minimal enforcement provisions and reasonable exemptions. That was negotiated and was also negotiated there would be a delayed effective date to match the federal law. However, at the time, obviously, none of us contemplated COVID or any of the other things that have made it very difficult for us to do things like that. We did, however, in that long negotiation, and here are the exemptions that were negotiated into effect. We did get those negotiated back in 2019. Included in the exemptions, and you can look at them here, technology failures, electronic failures are reasons for an exemption. The prescription prescribes a drug under a research protocol. Anyway, so all these things are exemptions, but one of the other exemptions that is in place is a low CDS prescriber exemption. Now, the state has not done the regulations in the 2+ years they've had to deal with the issue yet. So with that legislation, with those regulations not done, we don't know what a low prescriber is. The federal government defined a low prescriber as 100 scripts or less a year. We're hoping that the Maryland law will match that, but that, again, decision has not been made yet. The reason the exemptions are so important is the exemptions allow for a waiver, and that waiver process is essentially what the state is using to extend enforcement to make it match the federal law, and that's why you need to fill out a waiver. So that's the explanation of the law. But MedChi has also been working over the last few years on a non-legislative solution because we know that implementing e-prescribe into your office can be expensive. We want to figure out a way to do it in a less expensive fashion that would be helpful and useful. And we worked with Dr. First. Dr. First, a Maryland-based national company who is offering iPrescribe. When we first had this deal in place, they were giving it for a year free. Now it's 4 months free because we've had a partnership with them for quite some time. And then it's a reasonable monthly fee, but you get 4 months to try it out as of December 31st of this year, so the first quarter of 2022. You can give it a whirl and see what you think. The nice thing about this is it's an app you download on your phone, and it allows you to send an e-script. But the other nice thing about it is it has the prescription drug monitoring right on it. So you can look your patient up on the PDMP, CRISP, and see what's going on with them. And then you can write the script or not write the script. So that's a kind of business solution to this legislative legal problem. So essentially, the takeaways on this issue is the state and federal government have e-prescribing mandates for controlled dangerous substances that were supposed to take effect on January 1st of 2022. Both of those deadlines were extended, so you don't have to worry about it right away. However, you must file a waiver in Maryland if you're not e-prescribing for controlled dangerous substance. If you have any questions or need any help, please reach out to MedCai. You can do that in various ways, but feel free to email or call us, and we're happy to help you with this. Again, if you're a Maryland prescriber of a controlled dangerous substance and you're not able to e-prescribe, please request the waiver. It's the easiest way to keep yourself out of trouble and to go from there. And as always, reach out if we can be of help in any way. Thank you, and I hope this was helpful.